The truth. No doctor ever told you about poor circulation in your legs. It's 2 in the morning. You wake up with a violent cramp squeezing your calf. The pain is so intense you jump out of bed, stumble, and for one terrifying second, you're afraid you might fall. Your feet are ice cold, your toes are tingling, and a heavy, leaden feeling has settled into your legs as if they were made of concrete. You think, it's age. That's just how it works. Wrong. Completely wrong. What is happening to your legs is not inevitable. It is not just aging. It is the result of decades of dietary patterns, sedentary behavior, and chronic stress, combined with incomplete information that most people never receive corrected. According to the Society for Vascular Surgery, peripheral arterial disease affects approximately 8.5 million Americans over the age of 40, and chronic venous insufficiency affects another 6 to 7 million. The vast majority never receive clear guidance on what is truly causing the problem, or on what can be done. In this video, I will begin by showing you the 7 root causes of poor circulation, and right after that, you will receive 15 concrete, evidence-based steps to transform your vascular health. Not overnight, not with a single drink, over weeks with consistency. The 7 real root causes of poor circulation and 15 science-based steps to restore blood flow and reclaim your independence. Most online content reduces poor circulation to lack of nitric oxide or clogged veins. The reality involves 7 overlapping mechanisms, and understanding them is what separates temporary improvement from lasting change. 1. Endothelial dysfunction. 2. Chronic systemic inflammation. Fed by ultra-processed diets and visceral fat, it continuously damages vessel walls, without pain and without warning. High-sensitivity C-reactive protein, HSCRP, can detect this process before any symptom appears, and is an independent predictor of serious vascular events. 3. Atherosclerosis. Oxidized LDL cholesterol deposits in damaged arteries, forming plaques that grow, calcify, and reduce blood flow, especially in the legs. The American Heart Association warns that most patients with PAD do not present classic symptoms and dismiss early signs as normal aging. 4. Chronic venous insufficiency. Vein valves become incompetent over time. Blood cannot rise. It pools in the legs, causing varicose veins, swelling, and pain. It is a return problem, different from PAD, which is a delivery problem. Treating one as if it were the other does not work and can cause harm. 5. Peripheral neuropathy. Poor circulation deprives nerves of oxygen, causing tingling, numbness, and burning. The most dangerous aspect is not the pain, it is the absence of it. According to the CDC, approximately 34 million Americans have diabetes, and half will develop neuropathy, wounds on the feet that progress to serious infections without the person even noticing. 6. Sarcopenia. The calf muscles are the peripheral heart. They pump venous blood upward with every step. Muscle loss after age 50, aggravated by sedentary behavior, weakens this pump. Sarcopenia is estimated to affect between 10% and 30% of Americans over the age of 60. 7. Metabolic dysregulation. Elevated glucose binds to vascular proteins, glycation, making vessels rigid and brittle. According to the CDC, more than 96 million Americans have prediabetes, and 80% don't know it. Vascular damage is already occurring at this stage, even with apparently normal fasting blood glucose. Summary. Poor circulation does not have a single cause. It is a combination of all these mechanisms reinforcing one another. Addressing only one factor produces limited results. Arterial or venous? Which is your problem? Before implementing any step, you need to understand which type of problem you are dealing with. Many people have both at the same time, but the approaches are different, and some interventions that help venous problems can actively worsen arterial ones. Think of it this way. The arterial system is the delivery system. It carries oxygenated blood from the heart down to the legs. The venous system is the return system. It brings blood back. These are opposite problems, with different causes and different solutions. Arterial problem, PAD, peripheral arterial disease. Blood is not reaching your legs. Ask yourself, do you feel pain or cramping in your legs when walking, which disappears when you stop and rest? That is called intermittent claudication. It is the classic sign that the arteries are not delivering enough blood when the muscles demand more. Other arterial warning signs. One foot consistently colder or paler than the other. Shiny thin skin with little or no hair on the lower legs. Wounds on the feet or toes that take more than 2 weeks to begin healing. Symptoms that worsen when you elevate your legs. Gravity makes it even harder for blood to arrive. Venous problem, chronic venous insufficiency. Blood is arriving but cannot get back. Ask yourself, do your legs feel heavier, more swollen or more painful after a long day standing or sitting? And do they improve when you elevate your legs? That pattern is the characteristic sign that your vein valves are not functioning properly. Other venous warning signs. Visible varicose veins or dilated superficial veins. Swelling that is mild in the morning and worsens progressively throughout the day. Brownish patches or darkening of the skin around the ankles. A feeling of tightness or itching in the lower legs. Golden rule. If you identified signs on both sides, or could not identify any clear pattern, the correct starting point is a medical evaluation, not a home protocol. The ABI, ankle brachial index test, is simple, painless, and can distinguish between the two problems with precision. Ask your doctor at your next appointment. These steps attack each of the root causes above. Start with the first ones and progressively add the rest. Step 1. Walk every day. The pump that costs nothing. Daily walking is the most effective intervention for leg circulation. It rhythmically contracts the calf, stimulates nitric oxide production, improves insulin sensitivity, and reduces inflammation, attacking several root causes at the same time. Start with 20 minutes a day, 5 times a week. If you feel pain while walking, stop, rest, and continue. This is exactly the protocol recommended by American Vascular Medicine for claudication. Clinical trials published in the Journal of Vascular Surgery show that structured walking programs outperform, in many cases, the results of medications alone. Step 2. Remove the foods that destroy your vessels. Before adding any beneficial food, eliminate those that cause active damage. Refined vegetable oils rich in pro-inflammatory omega-6, added sugars, and refined carbohydrates that drive glycation, ultra-processed foods with excess sodium, and trans fats. The CDC estimates that more than 70% of American calories come from ultra-processed foods. This is not restrictive dieting. It is stopping putting sand into the engine you want to fix. Step 3. Fuel your diet with natural nitrates. Beets, arugula, spinach, watercress, and celery are excellent sources of dietary nitrates. Bacteria in the mouth convert them into nitric oxide, relaxing the arteries. Important detail: avoid antibacterial mouthwash before consuming these foods. It eliminates the bacteria essential for the conversion. These foods work as part of a consistent anti-inflammatory diet, not as an isolated solution. Step 4. Consume omega-3 with consistency. EPA and DHA reduce systemic inflammation, lower triglycerides, and improve endothelial function. Sources: salmon, sardines, mackerel, herring, 2 to 3 servings per week. The American Heart Association recommends fatty fish as part of a cardioprotective diet. The same mechanisms that protect the heart benefit peripheral circulation. If fish consumption is low, discuss supplementation with your doctor. 1 to 2 g of EPA plus DHA per day. Step 5. Use compression stockings, only when indicated. For confirmed venous insufficiency, graduated compression stockings, 20-30 millimeters for mild to moderate cases, are highly effective. Available at CVS, Walgreens, and online. Critical warning: they are contraindicated in people with significant PAD, Compression can worsen ischemia. Get the ABI, ankle brachial index, before using them if there is any doubt about arterial disease. Put the stockings on in the morning before getting out of bed. Step 6. Contrast hydrotherapy. Alternate 2 minutes of warm water with 30 seconds of cold on your legs, repeating 3 to 4 cycles in the shower. Always finish with cold. The alternation trains vascular elasticity, a workout for the smooth muscle of the vessels. No cost, no extra time, and most people notice a reduction in the feeling of heaviness within 1 to 2 weeks of consistent practice. Step 7. Train your calves, the peripheral heart. The calf raise is the simplest and most direct exercise for the venous pump. Stand up, slowly rise onto your tiptoes, and lower yourself with control. 3 sets of 15 to 20 repetitions per day, while waiting for coffee, cooking, or watching television. For those with balance difficulties, the seated version works equally well. Research shows significant reductions in leg swelling, comparable to wearing compression stockings, with the added benefit of reducing fall risk, which affects more than 14 million Americans over 65 each year, CDC. Step 8. Control your blood pressure for real. Nearly half of American adults, approximately 116 million, have hypertension, and only 1 in 4 has it adequately controlled, CDC. The target, according to the American Heart Association and the ACC, is below 130/80 mmHg. This requires sodium below 2,300 millilons per day, 1,500 millilons for those who already have hypertension, regular aerobic activity, healthy weight, limited alcohol, stress management, and when necessary, monitored medication. Step 9. Control blood sugar, even if you are not diabetic. Post-meal glucose spikes damaged vessels even in non-diabetics. Simple strategy. Start meals with fiber and protein before carbohydrates. Research shows significant reduction in the glycemic spike. Walk 10 to 15 minutes after meals. Target for non-diabetic adults is HbA1c below 5.7%. Between 5.7% and 6.4% is prediabetes, reversible with lifestyle changes, but aggressively destructive to vessels if ignored. Step 10. Prioritize sleep. During deep sleep, the body repairs the endothelium, regulates blood pressure, and releases growth hormone essential for vascular regeneration. The National Sleep Foundation indicates that 1 in 3 Americans does not sleep the recommended number of hours. The target is 7 to 9 hours per night. If you snore heavily or wake up gasping, get evaluated for obstructive sleep apnea, a condition affecting approximately 30 million Americans and a direct modifiable factor for hypertension and endothelial dysfunction. Step 11. Stop smoking, including occasional use. There is no safe dose of tobacco for anyone with circulatory problems. Nicotine causes immediate vasoconstriction. Carbon monoxide reduces oxygen transport. The free radicals in cigarette smoke actively destroy the nitric oxide your vessels produce. In the most advanced cases of critical lower limb ischemia, smoking is the primary modifiable factor. Call 1-800-QUIT-NOW, a free line available in all states, and ask your doctor about varenicline, bupropion, or nicotine replacement. Step 12. Treat chronic stress. The American Institute of Stress estimates that chronic stress contributes to 75% to 90% of all medical visits in the United States. Chronically elevated cortisol and adrenaline cause persistent vasoconstriction and systemic inflammation. Techniques with solid evidence: mindfulness meditation, 10 to 20 minutes per day, slow diaphragmatic breathing, and regular time in natural environments, all with documented reductions in cortisol and inflammatory markers. Step 13. Consider supplements with scientific backing. In the United States, supplements are regulated as foods by the FDA. Health claims are not verified before sale. Look for evidence in peer-reviewed journals. With medical guidance. Magnesium. More than 50% of Americans consume below the recommended amount. Relaxes vascular muscle and improves insulin sensitivity. Vitamin D. Deficiency associated with endothelial dysfunction, especially in the elderly and people with darker skin. NHANES data. Coenzyme Q10. essential for those taking statins, the most prescribed class of medications in the United States, as they reduce endogenous levels. Ginkgo biloba, EGB 761, evidence for intermittent claudication, contraindicated with anticoagulants such as warfarin or apixaban. Step 14. Get the tests that truly matter. Managing circulation without knowing the state of your vessels is navigating without a map. Essential tests. ABI, ankle brachial index, detects PAD by comparing ankle pressure to arm pressure. Venous Doppler ultrasound evaluates venous insufficiency and thrombosis. Full lipid panel including lipoprotein, ASA, HSCRP for active vascular inflammation, HbA1c to screen for prediabetes. All widely covered by Medicare, Medicaid, and private plans when requested with clinical indication. Bring this list to your primary care physician. Step 15. Build your protocol and maintain consistency. Here it is necessary to be completely honest about something most health content omits. Circulation is not a problem that gets fixed forever like changing a tire. It is a living system that continuously responds to your choices, for better and for worse. You stop walking for 3 months, the calf pump weakens. You go back to eating ultra-processed foods regularly, vascular inflammation returns. The habits need to be sustained, not at maximum effort forever, but as a permanent part of your routine. This is not bad news. It is simply how the human body works. Start with steps 1, 2, 3, 7, 8, and 14. These 6 combined attack the main root causes and produce measurable improvements in 4 to 8 weeks. Record daily how your legs are feeling on a scale of 0 to 10. In 30 days, you will have real data on what works for your body. When is lifestyle change alone not enough to solve circulation problems? This video was built for people in early to moderate stages, but there is a truth that needs to be stated. Some vascular damage is too advanced to be managed with habits alone, and denying that would be just as dishonest as promising a cure in a glass of juice. Advanced calcified arterial plaques do not dissolve with walking and beats. When an artery is blocked 70%, 80%, 90%, no dietary protocol reopens that lumen. In these cases, there are effective medical interventions: angioplasty with stenting to reopen arteries from within, revascularization surgery, bypass, to create new pathways for blood flow, laser or radiofrequency endovenous ablation for severely incompetent venous valves, and sclerotherapy for varicose veins with serious complications. For already established peripheral neuropathy, nerve damage rarely reverses completely, but rigorous glycemic control can halt progression and, in some cases, allow partial recovery over months. This is the difference between a condition that worsens and one that stabilizes. Lifestyle in these advanced cases does not disappear. It changes function. After an angioplasty or bypass, the patient who does not change habits frequently requires a new intervention within a few years because the same root causes continue operating. Lifestyle becomes what protects the surgical result and prevents progression to other vascular territories. How do you know which stage you are in? It is not possible to know without a medical evaluation. An ABI below 0.9 indicates PAD. Below 0.4 indicates serious disease that requires evaluation with a vascular surgeon, not just lifestyle changes. If you have pain at rest, wounds that are not healing, or any of the warning signs below, the starting point is not this guide. It is the office of a vascular surgeon. Most circulation content on YouTube makes a fundamental mistake. It presents a complex condition built over decades as if it had a single cause and a single solution. Your body produces 70% less nitric oxide after age 60. Drink this. Fixed. This framing is harmful. It creates false hope that leads to real frustration. When the shortcut doesn't work, people give up on caring for their circulation entirely. It can lead someone to replace a necessary medical evaluation with a supplement. And the specific claims, dramatic percentages within defined timeframes, are presented without verifiable sources, exploiting the trust of those who most need honest information. Beet juice has real evidence for nitric oxide production. Arugula is excellent. Hibiscus tea has support for blood pressure. These are legitimate tools. But none of them resolves a problem built from endothelial dysfunction, chronic inflammation, atherosclerosis, venous valve failure, nerve damage, muscle atrophy, and metabolic dysregulation operating simultaneously over decades. Vascular science is consistent. Comprehensive lifestyle intervention, addressing multiple root causes in parallel and with medical supervision, is what produces significant and lasting improvement. Anyone who promises otherwise is either misinformed or is not being honest with you. Warning signs that require immediate attention. Go to the emergency room or call 911 immediately if you have. Sudden and intense pain in one leg without trauma, with swelling, redness, or warmth. Possible DVT or acute arterial occlusion. A foot or leg that suddenly becomes pale, white, and intensely cold. Arterial occlusion. An emergency requiring intervention within hours. Sudden swelling in one leg with shortness of breath or chest pain, possible pulmonary embolism. See your doctor urgently, within days, if you have. Pain at rest, burning in the feet or toes present at night, not improving with walking. A wound on the foot, toe, or leg that has not begun to heal within 2 weeks. Sudden darkening or blackening of a toe or area of the foot. Significant new swelling in a single leg without apparent cause. Rapid worsening of symptoms despite lifestyle changes. None of these signs should be managed with dietary interventions. If you do not have a reference physician, urgent care centers and telehealth are appropriate entry points for initial triage. The choice is yours. You made it this far. That already matters. You now know that poor circulation has real, identifiable causes. You know the difference between arterial and venous disease, and why that distinction changes decisions. You know that the calf is a pump that needs training. You know that blood sugar, blood pressure, sleep, stress, and smoking affect your vessels more than any single food. And you know that habits need to be maintained, not as punishment, but because that is how the human body works. Poor circulation is not a sentence. It is a problem. Problems have solutions. Your next step is simple. Tomorrow morning, 20 minutes of walking. Just that. And build from there, one step at a time, every day. Because vascular health is not won in a motivated weekend. It is built in the silence of each morning when you choose to move, eat well, and take care of yourself. Especially when you don't feel like it. Especially then. Your legs have carried you your whole life. Now it is your turn to take care of them.